Hey everyone, David Kemp here from MarketScale Healthcare, giving you a glimpse into all the great healthcare content we published this month on MarketScale.com. Let's kick things off with a familiar face. For those of you who are regular visitors to MarketScale, it's Kevin Stevenson, host of the I Don't Care podcast. For this story, Kevin shared his insights on how the Great Resignation is making its presence felt in healthcare, and more specifically in the C-suite.
Hey, it's Kevin Stevenson, host of I Don't Care with Kevin Stevenson here on MarketScale. Here are my thoughts for what's going on in healthcare this week. You know, one of the things that I've seen in a lot of the trade publications is just the fact that the Great Resignation, if you will, has reached many executive levels in healthcare. There has been a number of CEO transitions over just the last few months, and I've heard from a number of recruiters that CEO turnover is really accelerating this year. You know, some people are just retiring. Some people have delayed retirements through COVID and are now fulfilling that desire. And many others are just finding different opportunities in different markets. So, you know, the issues that we have finding staff across the industry are not just with nurses or frontline employees. It is reaching all the way into the C-suite as well. So that's something that's going to be occurring over the next year or so. So be on the lookout for that. I always tell people, even if you're not looking, be friendly to your recruiters, offer them referrals, and just make sure that you keep your thumb on the pulse of the industry.
On April 21st, 2022, President Biden provided Congress with his administration's first national drug control strategy. The strategy focuses on two drivers of the epidemic: untreated addiction and drug trafficking. Dr. Michael Sprintz, founder and CEO of the Sprint Center for Pain, broke down Biden's plan for us.
Last week, we had a very interesting week when President Biden released the newest national drug control strategy, which is the White House's plan for addressing drug control and drug-related issues for our country for the upcoming year. He just turned it into Congress, and we will still need to wait to hear Congress's final approval or not regarding this. Now, what's really important is what's the meat of it? What's really going on? And, you know, we're looking still here at the opioid crisis. It is not ending. It is getting worse. Overdose deaths from drugs are continuing to escalate. Even though they're champing down on availability of prescription drugs, people are still dying. And there's a lot of reasons for this, and I've talked about this previously. But right now, we know that in 2020, there was about almost 96,000 people died of drug overdoses. And then in the 12 months ending November of 2021, we had 106,000 deaths. So that's almost a 16% increase in deaths that are occurring. So the problem is that it's not getting better, it's getting worse. And, you know, so, okay, what's our country going to do? What is our government going to do? What is their plan to help everyone address the substance abuse crisis and the overdose deaths? And I want to be clear about something. It's not just about the deaths. It's what, you know, dying is horrible. It sucks and it devastates everyone. But living with active addiction sucks too. It's horrible. It devastates lives. Myself, I've been in sobriety for over 20 years, but I lost a lot, including initially my ability to practice medicine for a while. Families lose their jobs, their kids, their freedom. It destroys lives. So there's a really important aspect of this, which the president does address in this national drug control strategy in helping people get sober. So it's not just about preventing death. It's about helping people who are suffering from the disease get better and get into recovery so they can live the rest of their lives out and have healthy relationships. So the main areas that President Biden and the National Drug Control Strategy focused on, or will be focusing on, they stated it will target actions to expand access to evidence-based prevention, harm reduction, treatment and recovery services. That's key. And while reducing the supply of drug trafficking and illicit drugs that are coming into our country. Let me address the illicit drug trade that's gone on since tens of years, hundreds of years. Drugs continue to go into our country. It's happening more and more. I want to be clear about one thing. If you eliminated all of the illegal drugs that came into the United States, you would not get rid of addiction. That's a really important point to understand. The idea of completely eliminating the supply does not change the demand. And we saw this play out as the DEA decreased the availability of prescription opioids. And yet what happened is the demand for opioids from people with addictive disease didn't decrease. It just pushed them into the black market, which caused the, shocking overdose rates that started to escalate the moment that occurred. And that's something that's really important to understand. I do believe it is a very good idea to try and limit the availability of illicit drugs. Don't get me wrong. I'm absolutely in support of that. But we must understand that and be clear that will in and of itself alone not stop the problem. It's one piece of the puzzle. And actually, I believe it's a significant piece, but the bigger piece and what's most important is creating opportunities and access for individuals suffering from addiction and substance use disorders to get help and to get treatment that's quality and that's affordable. So that's the other point. It's not just about having access to care. It's about having access to evidence-based, affordable care. You can have access to care to get treatment for a substance use problem, but if you can't afford it, it doesn't matter that you have access to it. And if payers are not paying for it, then you don't have access. The next part I want to discuss is the concept of harm reduction. And we've heard harm reduction a lot recently over the last couple of years as it relates to buprenorphine and as a means of helping to treat opioid use disorder. So harm reduction really kind of came into popularity in the 1960s with methadone. And at the time, there was a lot of heroin use going on, and people were, in addition to overdosing, people were robbing and stealing and hurting our citizens in order to support their drug habit. And methadone came along, and the concept of harm reduction came with it, with the idea that if you provided a substitute for heroin, that people would be able to take methadone and that they would no longer have the need to rob, cheat, and steal in order to support their habit and to prevent themselves from going into opioid withdrawal. And that had some effectiveness. Absolutely. It didn't solve the problem. It solved the problem. It decreased the issue of having people getting, or it decreased the amount of people getting robbed and stolen from, et cetera, as the behaviors that addicts that we must use in order to support, our addictions. Now, when we talk about harm reduction in current times, we're looking at it a little bit differently. We're talking about harm reduction, meaning decreasing harm in terms of actual overdoses, because the illicit drug market these days is very different from the 1960s. And that is, in almost like a massive amount of that is due to the availability of fentanyl derivatives. Okay. Fentanyl is one type of opioid, and it's actually used in the operating room all the time. When used appropriately in pharmaceutical use in the hospitals, it's a great medicine that does what it's supposed to do. When we're talking about fentanyl in the terms of illicit drugs or street drugs, we're often talking not about, in fact, we're almost never talking about pharmaceutical grade fentanyl, the actual drug itself. We're talking about fentanyl derivatives. And what that means is some illegal organic chemist in who knows what country, including our own, it adds certain chemical compound groups to a fentanyl molecule. And what that does is that it can decrease the cost to produce it. It definitely, like, it's a crapshoot when it comes to how potent it is. What are the side effects? Because no one's able to check. I have no idea what this is. I have no idea the potency. I don't know, have any idea of how much I'm actually taking. And so what that means is that the probability of overdose is extremely high, which of course we see with the overdose deaths. So I think harm reduction is a good idea. I think, again, it does not solve the core problem. And I'm a big fan of it's important to treat the symptoms, right? It's important to treat overdose death. It's important to reduce harm. And so harm is not just overdose, but harm also can mean sharing needles. It can be hepatitis C, HIV, all the blood-borne infectious diseases that are transmitted when someone uses a dirty needle. So being able to decrease harm by having pharmaceutical quality medications and treatment services available that may not necessarily be pharmaceutical, but there are different treatment services, including 12 steps, and which is your Alcoholics Anonymous, Narcotics Anonymous. There's over 270 different 12-step groups out there for all various sorts of addictions and behavioral process addictions, as well as chemical or drug addictions. So there's a number of different ways to treat addiction. So reducing harm is very important. Okay, so now let's get to the real important part. Treatment services. The problem is that if we don't have treatment services to help people not just get sober, but stay sober, to give them the tools to help them cope with life on life's terms, then we're screwed. It doesn't matter what we get rid of, because if we got rid of all the opioids, if having addictive disease, if I'm anyone with active addiction, if you get rid of all the opioids, well, then I would drink, or I would do cocaine, or I would do drugs, or whatever was available, because addiction is in the brain. It's not in the drug itself. It is a neurobiological brain disorder. Our circuits, our reward center is broken. The off switch is broken in that. Treatment makes a difference. It helps. So the most important takeaway from my entire talk right now about the National Drug Control Strategy is the importance about supporting the availability of affordable treatment services that are evidence-based, meaning we need to be able to give access to care to as many people as we can and do it in a way that they can afford it. Telemedicine is a great way to enable that to happen. Medications that help to keep people from withdrawal is great. There are not just medications, but there are also new devices that are coming out. They're actually in the market right now that help to manage opioid withdrawal. There's a lot of different ways to manage that, but there's also ways that we want people to stay in treatment long enough to learn the things they need to learn about how to cope with life, how to cope with emotions, how to deal with things in a healthy way where they don't hurt themselves or hurt others. And in the end, that's what it's all about. We have to help the people that are suffering through active addiction because it has impacted all of us. And the reward from doing all of this, and I applaud the government for putting together the National Drug Control Strategy, and I applaud everyone who has committed themselves in policy as well as in their own time and efforts and money in order to help create more solutions that are real world, that make a difference, that help people not just get sober, but live and stay sober a long time and become not just productive members of society, but productive members in their own lives. And that's really important.
All right, we'll wrap things up today with a word on inflation from Kevin Stevenson. Inflation has been a hot topic across a number of industries, and healthcare is no exception. Here's Kevin with his thoughts.
We're seeing the price of the pump go up. We're seeing the price of the grocery store go up. But it's certainly affecting us in healthcare as well. A lot of different ways it impacts us. Certainly, you look at the wage gaps. Our cost of living raises, our merit increases just aren't keeping up with what's going on today. And so our associates are feeling that pinch just like all of us are. So we have to find ways to help them gain control over their purchasing power. That's one thing. Number two, because of that, a lot of people are choosing not to have medical procedures performed at this time. just can't afford it. And so, that's not good. While that might be a short-term thought to save money in the long term, that's really not going to, because your condition is going to exacerbate. You're just going to get a lot sicker. And so whatever happens down the road is probably going to be more expensive. Of course, we start looking at all of our supply costs. Supply costs are going through the roof, as well as utility costs. And so we're looking at that, and it's not as easy for hospitals and other healthcare entities to pass that along, those cost increases along. So what happens to us is, we may have to, do things like cut hours. We may have to curtail some services. Unfortunately, some hospitals are making the decision to suspend services that really aren't contributing to the bottom line, so that they can keep their doors open. We're just like every other entity that budgets. We have to make sure that we are bringing in more money than we're spending, or at least trying to maintain that level. And oftentimes that's very difficult for us with how healthcare is reimbursed in this country.
Be sure to check out my podcast, Highway to Health on MarketScale, and stay tuned for more great healthcare content coming your way really soon. Up next, Tyler Kern takes you through the built environment.
Do you think there's anything wrong with your mind, really?
Not a thing, Doc.
A timeless classic, One Flew Over the Cuckoo's Nest, portrays a dank hospital with blank white walls, hard and uninviting furniture, and barred windows. While this may seem extreme, it isn't far from the impersonal and stressful environments many hospitals present today. Mix the impersonal atmosphere with machine beeping, blasting intercoms, and the noises of other patients, and you have the perfect recipe for patient discomfort, lack of privacy, and an overall negative experience. With many patients hearing over 86 noises at one time, no patient wants to deal with this compounded stress, especially on top of being sick or injured.
When you ask any patient who has spent the night in the hospital, they're going to tell you that they heard firsthand and that they recognize that exposure to noise, those decibel levels, right, can initiate stressors, and that aggravates health issues, meaning such that if we're unable to sleep, then our bodies are unable to heal.
There's lots of stuff going on during the day and certainly at night in hospitals. We've got so many pieces of equipment that are monitoring patients, and it's not just in your room. I mean, it's all throughout the hall, throughout the hospital, and so they make a lot of crazy noises. They're beeping, they're buzzing, alarms are going off, things like that. And so, it does get to be a bit of a pain, but we are very cognizant of that, and we're trying to make sure that we diminish that as much as possible.
Designing rooms in the healthcare environment for flanking noises and noise that come from the corridor or from adjacent room is something we do very well. We know how to do this as architects. We can even design for noises that are coming from outside the building pretty well. Where we remain challenged, and it's something that it's an industry issue, is how do we deal with the beeping noises and the alarms of the equipment.
Not only are constant buzzing distractions detrimental to patients' vitals, but speech privacy is another huge area of concern. With only thin curtains separating one patient from another in the same room in some cases, it can be easy to overhear what are supposed to be private conversations about surgeries, treatments, and in worst-case scenarios, death. HIPAA requires a confidential level of speech in hospitals, but how often is this actually adhered to? Lack of privacy can result in adverse feelings, such as patient nervousness and annoyance. It can even cause hesitancy for patients to fully disclose medical information if they fear lack of privacy.
Some things in a healthcare facility that might make a patient feel uncomfortable are things like overhearing another patient's conversation with his or her healthcare provider.
Other things that can cause some issues, people walking up and down the halls talking, and that's not only visitors, but it's also staff as well. And we've been real intentional about that, particularly during quiet hours in the evening. we ask our staff to make sure that they're speaking in lower tones, and if they can wait to have their conversation once they get to the nurse's station, that's great.
These distractions are reflected in patient satisfaction with hospitals. The Hospital Consumer Assessment of Healthcare Providers and Systems, HCAHPS, is a 29-item instrument for measuring patient perception of hospital experience after discharge. This tool plays a role in helping consumers choose the right hospital and holds a lot of value in determining the hospital's quality and funding. Dissatisfaction with hospital noise is a key weakness on the survey and scored as the second lowest item for patient satisfaction in the HCAHPS July 2020 through March 2021 discharge report.
Part of our reimbursement from Medicare is tagged into HCAHPS scoring. And so it's not a huge part, but it's still a part of it. And so, a consistently bad HCAHPS scores could certainly negatively impact us, in our star rating. Hospitals are rated 1 to 5 stars. 5-star obviously is where we all want to be. And so we really take a lot of a look at our HCAHPS scoring.
Quietness at the hospital has consistently been rated across the U.S. as one of the lowest rated items on the HCAHPS survey. So this reinforces the need to further continue to evaluate design strategies for interior finishes that are focused on reducing that unwanted ambient noise in the built environment as a whole.
Bottom line, the biggest impact if somebody's not comfortable in our hospital, it could impact their quality, and that's the last thing that we want to do. We want to make sure that we, again, are providing the highest level of quality that we possibly can for all of our patients.
The positive aspect is there's plenty of space for companies in the healthcare industry to improve patient comfort, reduce distractions, and improve privacy.
We get asked a lot of times, how do we help evolve today's healthcare spaces? We do that with colorful and flexible privacy. So flexible allows a space to be used for one thing one day and a different thing the next. And no longer is privacy in a healthcare setting a cheap plastic curtain that is pulled between you and your neighbor. There are so many more ways that you can divide space and make patients feel like they matter, feel like they're more than a patient, they're a person.
Atlas ID offers healthcare environments a number of technology solutions to help their buildings, campuses, complexes run more efficiently and economically. We also offer background music systems and sound masking systems that really tie into patient comfort as well as HIPAA compliance.
At Armstrong Flooring, we are intentional in our design focus to incorporate nature into the built environment, to inherently foster inspirational, restorative spaces with our diverse array of flooring solutions.
Hospitals really do take privacy seriously, and we certainly take your experience in our facilities very seriously. We want to do whatever it takes to help alleviate the stress on the patient and their families.